Hey everybody, my apologies again for this being late. At least this one's just a day late. Ran into a little issue following my heart surgery and just pushed everything back again. But here we go, and I'm trying really hard to get back on schedule. Thanks, y'all. Pineal Stories is intended for information and educational purposes only. The content shared on this podcast should not be taken as medical advice. We aim to raise awareness and foster thoughtful discussion around symptomatic pineal cysts. We are not providing medical guidance or diagnosis. Always consult a qualified healthcare professional regarding any medical concerns or decisions. Every individual situation is unique, and only your doctor can help you determine the best course of action for your health. Hey, everybody. Thank you for joining us again. This week we're here with Lori. Lori, tell us a little bit about yourself.
Okay, well, we live in Central Texas. My husband and I, we have two daughters. Our youngest is Shannon. Shannon, at age 12, started showing these unusual symptoms. It was anger, depression, headaches. I was at that time I was working for an optometrist, and we would see 1 to 2 tumors, over the optic nerve, in the front of the brain, and so I was kind of familiar with symptoms of brain tumors affecting vision and the optic nerve. And by that time, I had already stopped working for this eye doctor, but he continued to be our eye doctor and do the exams and stuff and prescriptions for glasses and contacts. And I finally just took her in, and I said, let's do all the testing. Something is not right. I'm taking her to the doctors, but they're telling me that yes, there is a pineal gland region cyst, but it's only measuring 5 millimeters to 6 millimeters, depending on the direction of measurements, because it wasn't a perfect circle. It was irregular. And that can't be causing all these problems. So she's just probably depressed, seeking attention, maybe seeking drugs. And I'm going,
Wow. And how old was she?
12.
Oh my
A
God.
12-year-old seeking attention and drugs. When was this, if I may ask you the year?
This was 2015.
2015.
Yes.
Wow. And so the symptoms, you kind of laid them out, the aggression and headaches and that stuff.
Well, and it got worse
Okay.
when we did that, and because he had already been seeing her and prescribing glasses and stuff, so he kind of had a baseline to work from.
Mm-hmm.
And he did the visual field test, and I don't know if you're familiar with that, but for the other people, you look at a stationary spot in this monitor, one eye at a time, and you have a little flashing light that flashes in various areas, and every time you see a flashing light, you're supposed to push a button. And as you're staring at that stationary spot, well, you have a normal blind spot in your line of vision on a horizontal axis that you don't see just because of the way the eyeball is designed. And so, that's normal. But she had lost the upper outside and bottom visual fields. She couldn't see the testing pattern on the outside on both sides. And he said, well, there is something going on neurologically. I can't explain to you what's going on, but I suspect there is some effect going on from the tumor or the cyst itself. And I said, well, they're telling me that it's only half a centimeter. That doesn't present as symptomatic. It's too small. And we continued after they said it was a pineal region cyst. I went to Facebook and started looking for any kind of information I could find, you know. Um, and I found this support group that Betty Tanner had started with her experience. And so I reached out to the group and introduced myself, told them what was going on. And they say, well, you're in Texas. You got Dr. Kim down in Houston at Memorial Hermann. You know, call him, see if he will take your insurance and, you know, talk to his staff, get it set up, get your medical records sent, do the initial appointment and see what they have to say. So within a month after the initial phone call, we had set up an appointment. It took another month to get in. So in 2 months' time from the initial phone call, we were seen. We walked in, sat down, and waited for Dr. Kim. Another doctor that was an oncologist that had worked as a pediatric oncologist at MD Anderson that had come over to join him. And up until then, we had probably seen maybe 10 different doctors locally, just getting, you know, not getting any answers, bouncing around, trying to find a specialist, you know, different areas, not really getting any answers. And so the oncologist walked in and goes, huh, her eyes are dilated to about 6 millimeters. So I went, yeah. I said, I've been asking every appointment why her eyes are always dilated, why she's always complaining about the bright lights. You know, the headaches she's getting and the bright lights make it worse. And he goes, yeah. He goes, yeah, that's an effect from the cyst. I said, well, they're telling me it's not big enough to have that kind of problem. He goes, it's not the size. And he goes, you know, you've had the MRI about 4 months ago. We're going to wait another 2 months. We're going to do another MRI, but we're going to do a different measurement of the cross sections. We're going to make smaller cross sections. He goes, so that way we can see more of what is going on. And so they did. He goes, but in the meantime, I want to send you to another pediatric neurologist down here in the Woodlands, and have him evaluate her. And the initial appointment with that doctor, Dr. Varghese, he said, oh yeah, she has POTS, postural orthostatic tachycardia syndrome. And he goes, but you know, don't go home and Google it. So me being me, what do I do?
Absolutely. And by the way, for those not familiar with Texas, the Woodlands is not what it sounds like. It's not a place out in the middle of nowhere. It's down near Houston.
Yeah.
Just to throw that out there, that the Woodlands has an almost ironic name.
Yeah, yeah. It's very pretty.
It is.
But so Dr. Varghese, you know, said we're going to put her on high salt, high fluids diet, you know, water, Gatorade, electrolytes, you know, salt, a lot of salt. So we did that. The reason Dr. Kim, the neurosurgeon at Memorial Hermann, wanted us to go to Dr. Varghese in the Woodlands was because the pediatric neurologist here put Shannon on amitriptyline as the first drug to deal with her headaches. And he said, well, Dr. Kim said, we don't use amitriptyline again. We especially don't use it on children. And he goes, this is why. This is one of the first drugs that they came out with. It's not effective and there's too many side effects. And we don't want those side effects playing into what is currently going on with all the symptoms. And I had a list of symptoms, the tinnitus and the changes in vision, the loss of peripheral vision, the pain looking up when, even without glasses, the brain fog, the dizziness, the nausea and vomiting, it was, I had a list of 15 different symptoms, and all of it was going back to something going on in the brain. You know, I started working at the local hospital here when I was 23. So not as a medical staff, but as a support staff. So I was around a lot of medical staff, and I learned quite a bit just being in that environment. Of course, I learned a lot about vision working for the eye doctor, the optometrist. Um, and so I knew what they were telling me was not accurate, that there was more to it than what they wanted to deal with. We were, um, after the second MRI, we went back and we'd had a lumbar puncture done, and that was in the Woodlands also. Um, and after that lumbar puncture, she came back into the room, and all of her symptoms had gone away. They had drained off 6 cc's of spinal fluid, relieving the pressure, um, and so her symptoms went away. In 3 days' time, when the pressure built up again, all the symptoms came back.
Hmm.
So when we went back to Dr. Kim at Memorial Hermann, I reported that. He goes, "That's interesting." He goes, "So it's creating more cerebral spinal fluid in the brain that should be there normally." So with us reporting that, he started adding at each workup of new patient a lumbar puncture for everyone, so that he would have a baseline to work from.
Hmm.
So I'm not really proud of the fact that we brought that to his attention, but I'm hoping it shortened some kind of diagnostic period for a lot of people. But up until that point, I don't think anybody had the background to sit there and just watch the before and after of that lumbar puncture. And yeah, it was like she was back to normal. But then in 3 days' time, the aggression, the anger, all the symptoms came back, the headache, the um, everything. So we were scheduled again for another 2 months after that MRI, and we went back to see Dr. Kim and his staff. And Dr. Kim said, "Well, we are seeing changes. The symptoms are worsening. It's not that we don't think it's the size. We think it's the location of the cyst itself." And they kept saying the pineal gland region. Um, and so he says, "We can go ahead and do the surgery. We have ruled out everything else. We're comfortable with doing the surgery. Are you ready?" And Shannon just panicked. And we asked Dr. Kim to just give us a little bit of time to work with her, get her prepared so that she wouldn't refuse it when we got there. That was our big worry, because I kept saying, now she's 13 years old. She's decided she doesn't want the surgery. We can't do it. So we came back, started working with a psychiatrist, a therapist, and a hypnotherapist. And by that time, she started having the tremors in her hands, in her feet, in her muscles of her face.
Mm-hmm.
But she was controlling them while she was awake. When the hypnotherapist would put her under, her tremors would get worse. And so the first session, the therapist left Shannon in the room, and she came out to talk to me. She goes, "Do you know she's having tremors?" I said, "Yeah, I've seen them." She goes, "Are you aware that when she's relaxed, they get worse?" I said, "No, I wasn't aware of that." And then the week before we'd made arrangements to do the surgery and all that. And we were going to stay down there 2 weeks. few days before surgery, and then 2 weeks past surgery, so that we make sure everything was okay to come home, because we do live. It's a 3-hour drive away to Houston from where we live. So we wanted to make sure that everything was safe for her to come home. Um, they we got there at 5:30 for an 8 o'clock surgery start time. She walked in like a trooper. And they prepped her, took her in. Um, Dr. Kim was training another neurosurgeon at the time. Um, and Dr. Kim would come out and give us reports every so often. And then he came out and he goes, yes, it's when we got in there, it's over a centimeter in size. So it'd grown in about 6 months' time or so, from half a centimeter to over a full centimeter. Um, and they said it was on the brain stem, not the pineal region. It was an actual cyst attached to the brainstem. And he goes, that's why you're having all the problems, because that's causing mass effect on the brainstem, which is a smaller area even than the pineal gland. And then you have the medulla and the cerebellum. Can't remember. Anyway, that was pushing on those lower parts of the brain. You know, where, the beginning of the vagus nerve, the 10th cranial nerve, comes down to the lower part of your body, regulating all the autonomic symptoms. So for the people that are a little bit more knowledgeable about the functioning of the body, that 10th cranial nerve, the vagus nerve, controls everything basically from the beginning of the brainstem down the rest of your body. So your heart, your digestion, everything in between. So that's why she was having all of the symptoms. As it was a hard thing to go through.
Yeah.
She still has the POTS, but she is not having problems with the hydrocephalus anymore, we don't think. We are she hasn't had any more seizures. She's had 2. But they put her through a monitoring unit for a 72-hour study. So it's not anything related to can't think of the word. Just went blank. Sorry.
It's okay.
So the seizures are because of the damage, not starts with an E. Just went blank. Epilepsy. That's it.
Okay.
Because they did the 72-hour epilepsy monitoring unit, where they take her off the anti-seizure medicine and try to trigger a seizure, and she never had a seizure. So it's related to what they call the migraine headaches. So they think it's the brainstorm in the brain wrapping around to another part of the brain and triggering the seizures. Luckily, we haven't had any more. But she continues with the headaches. She continues with some visual changes. Of course, there's still digestion issues. Some, nausea, vomiting. Her sleep pattern is still off. Um, we're in therapy still to deal with this, because she is just so angry at the medical profession that it's hard to deal with them for her. And she doesn't trust them. She doesn't trust any of them. So basically, we have a huge distrust, even of the emergency room, because um, that was the doctors that were saying, "Oh, she's making it all up. She's looking for drugs. She's looking for attention. She's, trying to get out of going to school. She's, all of this stuff." Um, and before she got sick, she was on the swim team. She was swimming 2 hours a day, doing competitions on Saturdays. In excellent shape. She was in orchestra. She was playing the cello. She was, doing all the things normal kids do. And I mean, it was like a light switch had gone on and everything changed.
Right. So this is the first non-pineal cyst story that we've had on pineal stories, and it's very interesting to hear that. Well, first they thought that it was pineal, and then it turns out not to be. It's brainstem, but there are a lot of similarities, and I wonder. Well, we'd need doctors to explain where those two really branch off. I
Oh,
do know that for the pineal, the cystic enlargement of the pineal gland, it causes the production of chemicals that are not quite right, and
uh-huh.
so it will flood your brain with these chemicals that are a little bit off. So it's melatonin, but it's not quite melatonin, and those
Yeah.
go bouncing around up there, and that's why, like in Kelly's case, it takes a year or so after the surgery to stop having symptoms because they've already been produced and they're still floating around up there,
Uh-huh.
and stuff still happens. But
Uh,
for her, since it was brain stem, um, it really was about that because I was kind of confused when the spinal tap helped because in Kelly's case it hurt,
yeah.
but so that makes sense that it was a pressure thing.
Hmm.
And now you've just got me very curious about which things there's on that tree of symptoms. There is a place where it branches,
Hmm.
and I wonder where that is because so many of those things sounded very familiar, even though it turned out to be a different thing. And unfortunately, the thing that sounded the most familiar was that medical journal of just journal was that
Sure.
medical journey of just trying to get the doctors to listen.
Yeah.
Yes.
That is
Yes.
infuriating. And
Yes.
this and so and your daughters, that one's not even all that controversial. It's just they just have to look.
Yeah.
Yeah.
I mean,
Yeah.
am I missing something on that? Because I don't think anybody, I've not seen anything where they're saying, well, no, there's a tumor on your brainstem, but don't worry about that. That's no big deal.
Yeah.
Well,
Like
it
they do
goes,
with pineal.
yeah, it goes back to the lack of 3D imaging.
Hmm.
And, because they're only looking at 2D imaging, but they're also, it depends on the plane that they take the imaging, the angles
Hmm.
of how they take the imaging, but also the depth that they go in each image.
So did she get what's called stealth mode imaging? That is where the depth, the slices are incredibly small so that they
It's
can catch things that are really tiny. Because after my uh, original MRI, just a regular MRI, they did what's called stealth mode. It takes longer because they're taking more pictures and the slices are really thin. I want to say like 1 to 2 millimeter thin. Like
that could have
really
been her second MRI.
okay.
Um, she has had three. We are getting set up for a fourth one of because now she's still having these, they call them migraine headaches. We've tried every medication available, oral, IV, everything, shots, um, the newest, the oldest, and all in between, and they don't touch the headaches. So, my question is, well, then it's not a true migraine. Then it is. What is it then? Is it the damage from the surgery? Is it the damage from the cyst? Um, the after on the day of the surgery, like I said, we were the first ones in surgery. It was 6 p.m. before we were allowed to go up to the neuro ICU floor, and she was still in recovery because they took the breathing tube out too soon, and her larynx started spasming. They couldn't get the breathing tube back in, so they put her on a CPAP machine with medication in it to open up her airways, and a steroid to stop the, you know, the swelling and stuff.
Yeah.
But they didn't have any anesthesiologists up on the ICU floor, so she had to stay in recovery until it was almost 6:30, I think, until they brought her up. So we were there from 5:30 to 6:30 in surgery ICU waiting area, just waiting for her to come out because of that. So it was a very long day, very stressful. But at one of the second neurosurgeon came out and talked to us while we were waiting for Shannon to come up, and we were in like the visitors lounge of the ICU floor for neurology. And he came out to talk to us. He goes, "Well, the surgery went well. We only had about 2 tablespoons of blood loss." He goes, we went in. He goes, "I saw that the pineal gland looked normal. There was no cyst." He goes, "But the cyst was on the brainstem. There was a blood vessel above and below that we had to, gently scrape off the cyst." And he goes, "And then we had to pop the cyst and then scrape it off of the brainstem." And he goes, we couldn't visualize that it was on the brainstem until we actually got in there during the surgery. So, up until that point, when they were visualizing it after they'd opened up her skull, they thought it was on the pineal gland also, because he said, we might have to remove the gland. But that's why it's so weird that everybody else we talked to, no, it's on the gland, and with her, it was on the brainstem. So, again, we are one of those types of patients that is very rare. And so, so now with this new pain management neurologist that we're seeing because of her headaches and other things, he wants to do a brain MRI to look for possibly a clot in one of her veins from the surgery. He's thinking that could be the source of her continuing headaches. But he also thinks that he wants to also do another lumbar puncture, possibly after the MRI of her spine, because he thinks that there might be some spinal fluid leakage coming out of her spine somewhere. That there might be a weakened spot that is also causing this. So we're back onto another journey of trying to put together pieces of a puzzle that no one really has even seen the picture of the front of the puzzle. So again, we're back to being the zebra patient that nobody understands.
Oh, wow. What's her age now?
She is 23.
Okay. Oh, I should have just done the math, but okay. Sorry.
No, that's okay. That's okay.
And so what is life like for that someone at 23 who's been through all this and is still trying to find answers?
It's hard. At 23, she should be finishing up school. And, there's no social life for her. All of her friends have gone on and moved on. she, if she socializes, she doesn't want strangers knowing her story. Um, because she wants to be accepted for who she is now, not who she was.
Mm.
Um, right now, um, she does um, things on the computer, um, plays video games, watches movies and stuff. She stays home quite a bit. I try to get her out to do things, and we take her places and stuff like that. Try to get her swimming and things again. But with her headaches, when her activity level goes up, her headaches get worse. When the barometric pressure falls, before a storm moves in, her headaches get worse. She, at one point, she was passing out almost every other day. We would go and get in an elevator and it didn't matter which direction we went. She would pass out on me. So I'd have to stand her in the corner and grab both bars, on either side of her and just wait for her to fall because I didn't know when it was going to happen because she would just nod off and pass out on me. So, and then we went to see a neurochiropractor in Michigan when she was very symptomatic after surgery. And she was on the ascent and descent of the plane. She had passed out maybe 5 to 6 times each direction until it leveled out. So altitude changes really was not a good thing for her to go through.
Right.
What else? After her brain surgery, we were still within a week's time post surgery, and she developed a hydrocephalus. So that we had to call the on-call doctor, and bring her in. And I will tell you, I was not ashamed to go in there and say, "This is Dr. Dong Kim's patient. He did surgery on her last, Wednesday, Thursday, whatever that was." And head of the neurosurgery department. This is his patient, so you take care of her. I was not ashamed of doing that at all.
Got to advocate.
That's right. That's right. That they put her on Dimox it was about 4 months. We weaned her off. She was good for about 3 months. And then the symptoms came rushing back. So I took her back up to our local hospital. This is about 4 a.m, and they, got her medicine and stuff, wrote prescriptions for Dimox and got her back on Dimox for the hydrocephalus. And that first ER doctor that asked me if she was seeking drugs or attention walked in at 8 o'clock with his start of his shift. And I said, "Oh, I'm so glad to see you. You remember the last time you asked me if she was looking for drugs?" I said, "I've got the paperwork here, which I've got the scans with me. I've got CT scans. I've got MRIs. What would you like to see? I've got the pathology report. I've got the post-surgical report. Which one do you want first?"
I love that.
I said, and you told me that wasn't possible. I said, "Here it is." And he read the pathology. He goes, "Well, it wasn't cancerous." I said, "You know what? Had it been cancerous, would we have gotten better care?"
Probably, unfortunately.
Wow.
And they don't like me because I don't back down.
Good.
Yeah.
We have, we've had a couple of stories of people who have gone back and talked to doctors or neurosurgeons who had denied this stuff before and had a nice mic drop moment. And I don't know, I'm pretty sure it's just the Texan in me, but I love that.
Well, I had our first pediatrician said, "Well, we don't operate on that part of the brain. We can't get in there to operate on that part of the brain."
Mm.
And I said, you should know this. There are surgeons that are operating on that part of the brain. And that makes me concerned because that tells me that you are not keeping up with current um, care for your patients.
Yes, one person on this podcast had a neurosurgeon tell her, well, talking of Dr. Patel, who had already performed her surgery, well, he should publish his findings. And she's like, well, he has. I'll print it out for you. So it's just, you know, maybe they're just overlooking it, but the information is out there. And that's the nature of this podcast, is to tell the stories as from as
Authentically.
many angles as possible,
Mm-hmm.
absolutely truthful, and to let them know how horrific these things are. And of course, the focus is on pineal, cystic enlargement of the pineal gland, but any brain malady it has the capacity to do obviously horrible things.
Mhm.
And getting the medical community to just
Take a closer look.
listen, look, pay attention,
Yeah.
know what's happening around you, and don't just go straight to denial when the facts are staring you in the face.
Mhm.
If we can move that needle an inch,
Yeah.
we'll have done our job.
Part of the problem was with every exam I said, look at her optic nerve. Do you see any problems with her optic nerve? No, the optic nerve looks healthy. Well, when with the opening pressure, her opening pressure was at the low point of being high. So you don't have at the low point of pressure on of the cerebral spinal fluid, you're not going to necessarily have optic nerve involvement or symptoms because it's just beginning to get into the dangerous zone, and they don't see that. They don't want to admit that their levels of understanding may not be low enough on their scale to um, give them the information that they need to make an accurate diagnosis. Um, so we continue to go forward with this the best way we can. We've tried to find the right specialists. We've tried chiropractors. I mean, we've gone to any specialist that I can think of to seek proper care. Even if it's considered fringe by some.
Sure.
Which you can't take her to a chiropractor. Yeah, well, why not? What am I getting here, or what are we getting here? And so,
Yep. Those doctors on the so-called fringe um, aren't always all that out there. They're just not, because my wife, as people will, by the time they get to this episode, will have heard in episodes 1 and 2, was a different person for 3 years.
Mm-hmm.
I mean, it was horrific. It was an absolute nightmare. And denial, 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 denial. One guy out of Mayo Clinic, like, yes, I can fix this. Oh, tumor board says no. Denial, denial, denial.
mm-hmm.
Dr. Patel, Medical University, South Carolina. Yes, I can fix it. He went in, he fixed it. I got my wife back.
Mm-hmm.
So these fringe doctors, I don't. If there's chicken bones involved, probably I'm going to avoid it. But the ones that are, that these people consider fringe, just they're not. They're
No.
actually putting in the work and they're listening.
Mm-hmm. Yeah. The neurochiropractor that we saw in Michigan, he he did the balance testing with her. He did the nystagmus testing, using I don't know if your wife did this with the goggles, and they're supposed to, what they're doing is actually making recordings through the goggle lenses of the eye patterns.
Yeah.
We're following movement and stuff of this little ball or something across the screen, and what they're tracking is the actual abnormal movement of the eyes as she's staring at that ball.
Yeah, Kelly never had that, but we have heard about that since.
Yeah.
So that's
yeah.
Yeah.
So and he went after he got all the medical records and everything that I had up to that point, and when he did the initial exam on Shannon, that's when he said, "Oh yeah, it's the pons in the medulla area of the brainstem that has been damaged because of mass effect of the cyst." And up until that point, nobody could answer that question.
Mm-hmm.
And I'm going, why is it taking us so long to get to that answer when a MD should be able to tell us this and not having it told to us by a chiropractor?
Yeah. The zebra analogy you mentioned earlier.
Yeah.
Yeah.
Zebras.
No. Yep.
The
Exactly.
zebra analogy is if you hear hoof sounds, hoof beats,
Yeah, you think horse, not zebra.
you think horse, not zebra.
Yep.
Yep. But when I did some research, and I think with the tumor on the brainstem, it only happens to 1% of the population of the United States. 1%. That's why it's not taught in medical school. That's why these procedures aren't. You don't have enough patience for all the medical schools to see it.
Yeah.
Much less teach it.
I know that's a problem.
Mhm.
That even with the pineal cyst stuff. So if you do the math on the pineal cysts, there's the percentage of the population that has a cystic enlargement of the pineal gland. It's a very significant number. A bunch of us have it,
Mhm.
and then there is a percentage of that group in which they are symptomatic. And so that number, because those are so difficult to get, that number is somewhere between 500,000 and 16 million.
Yeah.
So we just say 8 million.
Mhm.
We just split it in half, say there's about 8 million.
Yeah.
And then the number of those that have the symptoms that ramp all the way up to full-blown psychotic breaks and delusions is a smaller subset still. And those, the NIH has a write-up on one young woman that went through some really horrific stuff, and that's the case that sounds the most familiar to Kelly and I, out of all the ones that we've heard so far. But I mean, when you get to that point, the chances that any doctor will have themselves seen it and understand what's going on is understandably a stretch. It's going to be, we get that.
Mhm.
But those 8 million or so that are symptomatic, that have the usual, the brain fog, the headaches, the eye involvement, the stuff that kind of goes along with it, the quality of life deterioration that they experience, to the point that we've been very fortunate to talk to a young woman before and after her surgery. And we've talked to a whole bunch that have already had the surgery and did not realize what life was supposed to be like until after the surgery.
Mhm.
And in one mother's case, there was this dawning realization that her kid was probably suffering with this for a decade before they had any concept that there was even something wrong, because some stuff that had happened a long time ago is no longer just like part of what they thought her personality was, and part of they believed that she had a particular ailment.
Yeah.
Now that ailment, along with everything else, has just disappeared. And oh my gosh, it was probably that the whole time. So we get that it's difficult, But we also know that there are doctors out there like Patel and
Mhm.
Dr. Teo and some others that recognize these things
Right.
and will treat them. And so we're just asking for these folks to pay attention to the research, and if nothing else, be willing to send patients to the ones who understand it.
Right.
Yeah.
And Dr. Patel is so thorough. He doesn't just give somebody, he doesn't just say like that somebody is a candidate. He really takes his time and he listens
Mhm.
to the family and to the patient. And so if we could just get doctors to refer people to someone knowledgeable,
Yeah.
that would be a great
The
step.
part of my answer with the medical establishment is, we don't expect you to have the answers. What we do expect of, doctors is for them to take the time to find the people that might have the answers
Mhm.
Yes.
and refer them out.
Right.
It's not a stain on your profession or your career. And if you're not taking care of your patient by doing that, then why are you a doctor?
It's more of a stain on you personally, I would think, to have an angry patient or mom come back into your office with the medical records that prove them wrong and do the mic drop moment. I think that's probably worse than saying, I don't know. It's okay to not know. Nobody expects every neurosurgeon to know everything. I think there are subspecialties,
Yeah.
and some things require a subspecialty. So Kelly's leaving the room. Hey, babe, come over here and say hey real quick, because we are going to wrap up here in just a second. So if there's anything else, so this is my wife, Kelly.
Nice to see you.
Hey, nice to see you.
Having any further symptoms or anything? Nothing.
No, it's been awesome.
It's been, yeah, amazing.
3 years of hell, and then everything's great.
Yeah.
I still have dealing with the after effects of breast cancer, and I do have a very small brain lesion, but it's not where the cyst was. The cyst is gone.
Those chemicals aren't being produced anymore, and I got my wife back. It's amazing. She's also on tamoxifen, which causes horrific bone pain and all these issues because it fights cancer and also causes some.
Yeah.
And so with all these things going on, life is still so much better.
So much better.
So that's where our level was.
Yeah.
That, you just have constant daily pain. Cool. Congratulations, you're better.
Yeah.
Yeah.
So, all right, everybody. Thank you for listening. We really appreciate it. Lori, thank you for being here and telling your daughter's story.
Okay. Thank you so much. Appreciate you. Bye-bye.
Everybody have a great week. Bye, y'all. Thanks for listening to this episode of Pineal Stories, where patient voices matter and real stories have the power to drive change. If you or someone you love is living with a symptomatic pineal cyst, know that you are not alone. Our community is growing, and your experience matters. Share your story, connect with others, and help us push the medical conversation forward. Visit pinealstories.com to explore more stories, submit your own, and stay connected. And if you found this episode meaningful, please consider leaving a review and sharing it with someone who needs to hear it. Until next time, stay strong, stay informed, and keep speaking up. This is Michael Abels with my wife Kelly, and you've been listening to Pineal Stories. Thanks, y'all.